Hello friends, welcome back to my YouTube channel, TutorMed, where everything medicine is simplified. How has your experience with TutorMed been? Let us know your thoughts in the comment section. So some of you sent me a message to list some of the tools needed for the OSCE and the instances they will be needed. So I just decided to make this short video to that effect. If you haven't subscribed yet, kindly do so and hit the notification bell to get updated on our new video uploads. Thank you. Let's begin this video. And so particularly for the medicine OSCE, the first thing you need is a good stethoscope. Any good stethoscope like shown on the left. You can have or you can get a Littmann stethoscope or an Artscope. Instances you need this tool is to auscultate for heart sounds and murmurs during the cardiovascular exam. You'd also need it to auscultate for crackles, fine crackles at the lung bases during the cardiovascular exam to prove that the patient has pulmonary edema. You would need this tool to auscultate breath sounds during the respiratory examination. Again, you will need it to auscultate bowel sounds, renal, and hepatic brew during the gastrointestinal examination. And so the stethoscope is not limited to the cardiovascular examination. It is relevant in the respiratory and gastrointestinal examination stations. And so moving on to the next tool, you need two long rules, or rulers if you will. You may be wondering, what do I need a rule for in a medical exam? Well, you need a rule to measure the height of the JVP, the jugular venous pressure, in the cardiovascular exam, as shown in the diagram below. So here, you see the examiner using two rules to measure the height of the JVP. The first rule is put on the sternal angle of Louis on the chest. And then the next rule, or the other rule, is put on the height of the JVP in the neck to estimate the height of the JVP. So do not enter a cardiovascular exam station without your rulers or your rules. And so for the fourth tool, you need a tape measure. You do not necessarily need one with a BMI calculator as shown on the left. All you need is a decent tape measure. Instances where this tool is used, it is used to measure the liver span during the gastrointestinal examination to tell whether the liver is cirrhotic or not. It is also used in gastrointestinal exam to measure and classify splenomegaly. If you are able to examine for the spleen and you feel the spleen below the left subcostal margin, then there is splenomegaly. Then the tape measure can be used to measure how low the spleen is from the left subcostal margin. And based on how low it is, the spleen or the enlarged spleen can be classified into mild splenomegaly, moderate splenomegaly, and then massive splenomegaly. Then it is used to measure the circumference of a swollen limb or unilateral limb swelling. If in general exam you are able to identify by inspection that the patient has an obviously swollen limb, to objectively prove that, you need to measure that limb and prove that it is bigger than the other limb. Then particularly in surgery, it is used to measure the size of superficial swelling. So if you have a lipoma, a tape measure can help you measure the size. And then in obs and gynae, it is used to measure the symphysiofundal height of a gravid uterus. Then, lastly, the tape measure is used to measure the size of abdominal masses, be it fibroids or appendiceal masses. And so next, we have the tuning forks, which can come in varying frequencies. We have the 128 Hz tuning fork, the 256 Hz tuning fork, and then the 512 tuning fork. Its uses: it is used in the Rene and then Weber's test. These two tests are used to assess the hearing loss of a patient. Together, they can tell whether the patient has a conductive hearing loss or a sensorineural hearing loss. It's okay if you do not understand these terms, but just note that the use of tuning forks in exam, one of them is to do the Rene and then the Weber's test. And these tests can differentiate between a conductive hearing loss and then a sensorineural hearing loss. We will look at this into detail in our subsequent videos. Usually, the tuning fork used here is the 512 Hz tuning fork. Then next, we have the joint vibration sense in neurological exam. The tuning fork is struck and the patient, with the eyes closed, is asked whether he can perceive the vibration of the tuning fork. Here, the frequency used is the 128 Hz tuning fork. Then sometimes during facial nerve examination, the tuning fork is used to test for hyperacusis, which is exaggerated hearing, and can be present in a patient with facial nerve palsy. Now, this diagram illustrates the Weber's test, and then the Rene test. Just note that these two tests together can differentiate between conductive hearing loss and then a sensorineural hearing loss. Our next tool in OSCE is the pen torch, and it should have a white light. It is used in oral examination. When you get to the mouth, you ask the patient to open the mouth to inspect for a satisfactory oral hygiene. We use a pen torch for that. And there is something called showmanship. For example, when inspecting for surgical scars on the chest, you can just inspect with your eyes. But in order to impress on the examiner that we are actually checking for surgical scars, we turn on our pen torch, then we inspect the chest, although we do not necessarily need the pen torch to do that. That is called showmanship, so that the examiner is made aware that we are actually doing what is expected of us. And the third is usually in surgery for transillumination of superficial swellings. You put the pen torch on the side of a superficial swelling, and then you will look whether the light is transilluminated through the superficial swelling. If that occurs, then most likely the swelling is fluid containing. And sometimes we use the pen torch to assess the reaction of the light or reaction to light by the pupils. It is used to assess pupillary reaction to light, whether it responds to light adequately or not. Yes, and the flexible patella hammer, and that's a diagram on the left side of our screen. It is used to examine the deep tendon reflexes during a neurological exam. So the bicep tendon reflex, the patella reflex, the ankle reflex. And then its tip is used to examine for the Babinski reflex, as demonstrated below. And then last but not the least is the stethoscope case. Now, this is not a requirement actually. It is not a requirement at all, but it helps you in your organization. It provides space to keep your stethoscope, your patella hammer, your pen torch, your tape measure. It is better to have it that way so that you don't have things scattered in your lab coat and then you don't know where your stethoscope is. So a person who has the stethoscope case looks organized and then looks prepared for the exam. in the eyes of the examiners anyways. And so this is not a requirement, but it helps you in your organization if you have one. Alright guys, this is the end of this video. All the best in your OSCEs, and then see you in our next video.